Hi, I'm Daniel Nyman. On behalf of the Forum for Healthcare Strategists, as well as our colleagues at Monigle, welcome and thank you for joining us for the new dynamics of trust in healthcare. Distrust is rising in healthcare, and the impact is real. More than 1 in 4 consumers have switched providers after trust was broken. In today's webinar, you'll hear what's driving consumer distrust, how trust influences choice, engagement, and revenue, and what healthcare brands can do to rebuild and sustain confidence. Before we begin, a couple quick notes. Attendees are participating in listen-only mode, but you can still ask questions. If you have a question, please enter it into the question and answer pane located on the bottom of your screen at any time. We'll respond to as many questions as we can in the time that we have. Also, we'll be conducting some audience polls today, so please participate when those come up on your screen. With that, I'll turn the program over to our speaker, Dave Middendorf. Dave is Executive Director, Health, Care, and Wellness at Monigle, and we're pleased to have him with us today. Dave?
Thanks, Daniel, and thanks everyone for being here today. This is a really exciting topic, and we're happy to dig into it. I think it's really timely. Looking forward to hearing your responses to some of the polls, getting some of your questions at the end as well. Before we really dig into the topic, I just wanted to cover off on a couple of updates to Humanizing Brand Experience. I'm sure many of you are familiar with this study, and we've kind of changed it up this year, where we used to present and report out in kind of one big chunk, right? One big book with lots of data that was all gathered, typically in November, December of the previous year. And what we're trying to do now is to break it up into essentially more digestible chunks, but even more importantly, more timely chunks of information. So trying to figure out what's most top of mind for y'all and how to get out there with consumers to get that data and report out on the trends that you're seeing. So what you're seeing today around trust is really the first wave or first iteration of this approach. The other thing that I'll mention is that we'll still be producing the larger report that releases in May, and it will have the most human brand rankings as part of it. So what we'll start to do is aggregate some of these chapters together, but also be revealing new content and that year's rankings. And just a reminder of what these rankings mean and what the humanizing brand experience model and philosophy is. At the end of the day, it's really a model for how people make decisions. This model explains how and why people are choosing and recommending the brands, the healthcare brands that they engage with. And the model looks at all different aspects of how people are engaging with brands. Everything from the way that they sense brands to the things that they think about brands, those emotional connections that they build with brands, the way brands make them feel, to the actual behavioral things that they do with brands. So just want to emphasize that this trust is just one component of the broader spectrum of how people engage with brands. But it's been something that's very top of mind for our clients. We get a lot of questions around trust. In last year's report, we actually had this data which showed just the variation of trust in the different parts of the country and how different people, how different places have different levels of trust with the providers that they engage with. You can see maybe you'll find your market on this slide and get a sense of, are you in a trusting market or a place where maybe there's more distrust than we would like to have. We also reported out on some of the most trusted brands. And I think one of the interesting takeaways here is that a lot of these most trusted brands are AMCs. They're affiliated with universities. They have deep research and innovation and expertise. And this is different than the list of the most human brand rankings, right? So some of these do show up in that top 10 list, but not all of them. So just an interesting kind of take on some of those brands that are leading in this trust dynamic. But one of the things that really kind of spurred our curiosity around trust is this data point from last year. And what we saw was this level of distrust of people not trusting their provider to make the right decisions for them was essentially going in the right direction for most of our age groups here. But if you notice the age group on the left, that youngest age group, you could see that this level of distrust was actually going the opposite way. It was increasing, and it gave us a little bit of a warning sign to say, is this going to happen across these other generations? And a really important point about this data set is it was collected in November and December of 2024. So think about how much the world has changed since then. And that's why, we really wanted to dig into this data in a more timely way. And so, just thinking about the dialogue that, unfortunately, at this point is kind of one-sided. Just some of these questions that, you should be thinking in your mind of, what conversations are happening about trust in your organization? What questions are you being asked? What are your stakeholders' concerns when it comes to trust? And so, with that, we wanted to do just a quick poll. We've got a couple quick polls in here, like Daniel mentioned, and just kind of want to get your take on, how often is trust coming up as a topic with your stakeholders? Is this something that's happening every day, once a week, once a month, or is it never happening? So feel free to jump into the poll and start answering these questions. Should be an easy question, but would love to get a sense of where your organizations are at. Wow, it's pretty mixed. Interesting to see that there's very few nevers. I think there was only one never in the voting, so that's good. But a lot of people here, about 30% of people are saying that it's happening every day. About 22% once a week, 23% say once a month, and as well 23% say rarely. So interesting that there's a mix of kind of frequency that trust is coming up as a topic. The other thing that we wanted to ask from a poll question was just to understand which side of the trust dynamic seems to be getting the most attention in your organization. Are people talking to you about how do we earn trust, or are people talking to you about just strategies for not losing it? And I think this is interesting because it's one of the dynamics that we're going to dig into today is we've talked previously about how trust is built, but a lot of the data that we'll share today actually leans somewhat more into the not losing it side. So what are the things that actually create distrust, and what are the impacts when the levels of distrust rise in an organization? So we'll give you another couple seconds to vote here. Interesting again to see the balance. It certainly tips towards the earning it side. So that 61% of the people here said earning it, 39% said not losing it. So I think you'll see strategies today that really allude to both sides of this dynamic. But I think we'll have an interesting conversation. And this is something that we mentioned before, that this is top of mind with many of the health system partners that we talk to on a regular basis. And, some of these kind of things that we've heard are about a lot of our conversations around trust have to do with the information that's being put out by the federal government or the CDC and how it's evolving. You want to be seen as a trusted healthcare resource, but how do you balance that with the other information that's going out? So a lot of these things that we're hearing are almost a reflection of what's happening from a government policy, even legislative standpoint. But then there's also the other side of it where so many of our consumers are out there engaging with social media. They're seeing different types of information on social media that might not be scientifically accurate. And a lot of systems are really asking that question of how do we maintain that trust when there's so many sources of information out there that might not be giving people the best information. I will use this as a quick plug for the next topic that we're actually working on right now, which is consumer perceptions of legislative changes. So we're kind of digging into the political side of the equation in the next chapter that we'll be launching in a couple weeks. But just to give you a quick background on this study was conducted back in September of 2025. Again, really just focusing in on the dynamics of trust. This was 1,000 respondents across the U.S. You can just see some of their kind of demographic profile there, of their age, and people can't work in the field, some of those basics. But so with that, let's dig into some of the data that we found. Um, the first place that we wanted to start with was really thinking about it through the lens of what's the impact on business when it comes to trust and distrust. And I think the interesting thing here is when we actually correlated the data with our engagement index. So the engagement index is something that we typically research in the Humanizing Brand Experience report every year. It gives us a sense of how engaged people are with healthcare and wellness across a bunch of different factors. And what you see in this data is that as trust increases, it's actually increasing what people say is the emotional value that they get and the symbolic value that they get from engaging with care. So, emotional value is I feel peace of mind after receiving healthcare services or treatments. And symbolic value is defined as I think it's worth the extra cost to go to the best healthcare provider or facility. So, what this data actually sets up is this interesting dynamic from a business standpoint where it's kind of playing to two different sides of growth, right? There's this the reinforcing choice and loyalty side of the equation that we really see happening in that emotional value. So that idea when trust is high, patients are feeling that greater peace of mind from receiving treatment. And then on the other side, you see this opportunity to amplify growth through what we call that symbolic value. So thinking it's worth the extra cost to go to the best healthcare provider or facility really starts to open new doors. So when you think about building trusting relationships with your consumers, it's not just about keeping them loyal and keeping them connected emotionally to your brands and your organization, but it also opens that door to potential new avenues of growth, ways to connect consumers with adjacent services that you offer, preventative programs, wellness resources, things that can really change not only the value that they bring your organization, but the value that you can provide to them. So, trust is really an interesting dynamic. And, when you think about trust is something that's built over time, right? You kind of come to expect what an entity you engage with is going to do in any given situation. But the other interesting thing about trust is that even though it takes a long time to build, trust is something that can just collapse overnight. And there's lots of tales out there in all the industries that we engage with where brands have lost trust. You can think of Bud Light losing sight of its core audience and people rising up to protest it. You can think of Volkswagen as a great example where they were cheating on their emissions and got caught for it. So they lost that trust almost in an instant. But each of these things are representing those moments where years and years of equity building and investment and brand was essentially undone in a moment, and consumer behavior can shift just as fast. The quote here on the screen, illustrates one of those kind of worst case scenarios of what happens when people lose trust. So I select my healthcare providers for their skill and attention, but if I can't trust these, I will immediately find another provider. So that's kind of one of the most important aspects of what we found here is what happens when trust is lost. And what we saw in the data was that 28% of people said that they have actually switched healthcare providers because they had that trust fracture. They got to the point where they just felt they no longer trusted them and then they were going to find a new provider. It's less likely to happen rapidly, I think, in healthcare. I think it kind of chips and erodes over time, which will relate to some of the recommendations that we'll make at the end here. But ultimately, it just reinforces how strong the idea of consumerism is in the healthcare landscape, where people do have choice, and trust is one of those factors that actually moves people to switch. It's also important to look at how this plays out across different generations, different segments, different demographics. And what was surprising here is that it is pretty consistent. As you can see, most of these switching behaviors are in that 25 to 30% range for consumers who fall into all these different categories. So Gen Z maybe haven't switched as much because they just haven't had enough time and experience engaging with the healthcare industry to lose trust and switch. Even though they're entering into it, you'll see in a couple slides with less trust. From a segment standpoint, we'll talk a little bit more about segments, but these are our healthcare attitudinal segments who we really want to understand how they behave and how their behavior might be unique based on their attitudes. Generally, we see that switching behavior being pretty consistent across them. You do see those whole health managers who are a segment that is generally distrustful of traditional healthcare systems and providers. They are the most likely to have switched, so not a huge surprise there. But then again, from a demographic standpoint, not much difference between men and women, not much difference between ethnicity, not much difference between insurance types. So this switching behavior really plays out across the gamut of consumers. So the other thing we wanted to look at is just what is the current state of distrust? How much distrust actually exists out there? When we did the Humanizing Brand Experience Volume 8 last or back in May, we actually we were pretty encouraged because we saw that some of these distrust and trust numbers had been stabilizing. We talked on that slide earlier, for most generations, the level of distrust was going down. The good news, that's generally remaining stable, but there is a but coming. What we do see is that 28% of people overall say they don't trust their healthcare provider to make the right decision for them. So, like I mentioned before, that's been relatively consistent with the overall data that we saw last year. But again, from a actual generational standpoint, you can see that that generational trend actually tells that familiar story that we talked about earlier. You can see that on the left side that Gen Z is the most distrustful generation of their healthcare. That's 22 plus 27%, right? 49, almost 50%. So almost half of millennial or Gen Zs would say that they actually have somewhat or strong distrust in their healthcare providers. It's a little bit less for millennials, and you can see that those top boxes generally decrease as the generations move to the older side. So we're not seeing any signs of reversal in that Gen Z demographic, and we'll continue to test this. And I would imagine that that distrust might just continue to increase. The other one that's really interesting, and this data actually wasn't published in the full report. So this is us taking a closer look at the trust trends from when we measured it in 2024, at the end of 2024, to this study. So you can see the two bars essentially comparing those levels of distrust across our different segments that we've identified. And the really kind of alarming thing that we saw here was that we're seeing that intensity of distrust is what's really changing. So if you look at that orange bar on the top, that's showing how people in 2024 were strongly distrusting to how they are back here in September distrusting of their health care provider. And you can see that more and more are strongly distrusting. So a lot of those people who were more somewhat distrusting have essentially migrated to being strongly distrusting. And you can see that for most of these segments, it's doubled, and for some of them, it's nearly tripled. So when we see, again, those whole health managers, those people who are generally distrusting of health systems, but are deeply engaged in their own healthcare and wellness and looking for alternatives, they are reaching extreme levels of distrust, which is going to really impact their behaviors. Same with the Dr. Dodgers. And we'll dig into those a little bit more here because those two groups kind of illustrate these different challenges that are, kind of associated with what happens when distrust rises. So with those, whole health managers, again, they're trying that it's in their attitude, it's in their natural behavior to be avoidant of traditional healthcare. So the risk for them is that as this distrust rises, when they actually do need to turn to healthcare, they're going to be, more skeptical, more difficult to engage when they actually need, serious care. They're going to be potentially less healthy as a result when they do show up. But it also is an opportunity. I think they're a major opportunity for health systems to start acknowledging what their expectations are, really addressing their whole health needs. Being a target opportunity to really start to re-engage them so they don't just have the pattern of avoidance, but actually figuring out ways to build that alliance around whole health mindsets so that we can actually grow with them and bring them closer in. With the Dr. Dodgers, so as their name suggests, these folks tend to not go to the doctor as much as they maybe should. It's not because they don't like healthcare. They actually do care about their healthcare and wellness, but these tend to be younger individuals with busy, young families. They're busy. They're fitting healthcare into their lives is challenging, and also the expense of healthcare is more of a challenge to them. So the challenge with rising distrust among them is that they're already avoidant. So as they become distrustful and continue to be busy and worried about the finances, then they're going to be much more likely to, disengage from healthcare totally and become more of the maybe unapologetically unhealthy segment that we have who really just disengages. So that disengagement again can threaten their overall healthcare and wellness as they're avoiding more preventative care, avoiding mental health care and showing up in healthcare situations only as a last resort. So we wanted to ask people, what's the reason for the distrust? Why don't you always trust your healthcare provider to make the right decisions for you? And, we asked them an open-end question here where they were typing in their responses. And you can see there's a pretty wide variety of different reasons. There's things like, people just want a second opinion. There's some people who, again, just really want to kind of make their own decisions, do their own research. They're much more self-reliant. And then there's some serious ones on here as well, right? Thinking of a provider making mistakes. But then you also see things like those past negative experiences. But the ones that clearly stand out the most, they're at the top, which we most frequently heard from consumers, where this rushed on personalized care and then just this financial or provider motives are misaligned. And it starts to illustrate these kind of two main dynamics that we're seeing within what's causing so much distrust. One is really functional, this idea of the rush to move faster, and which is kind of surprising, right? Because we think about the world that we live in, and we want things to be faster. We want things to get them right away. We want things on demand. But and that's true for a lot of healthcare as well when it comes to scheduling an appointment, right? We want things to be fast. But there are moments in the healthcare journey where, people really want it to slow down. People want to be seen, they want to be heard, they want to be understood before being treated. So that speed that often is happening because of the pressure to just get, more throughput, more appointments, meet that financial bottom line, is causing that sort of immediate level of distrust because people can feel it in those moments. The second one, I think, is actually much more concerning because it's much more challenging to fix, and it's subtle, right? This is where people are questioning whether care is being influenced by, bureaucracy. Are there sketchy incentives? Are there business goals that are at play before that come before people's, individual interests? So I think that's really one of those kind of scary places where distrust can really start to grow. It kind of goes back to some of those quotes we brought in earlier from other healthcare leaders that we talked to, of just, those sort of misaligned views of what truth is. And so I think the data that we'll share in the next chapter we produce around perceptions of legislative changes and some of those things will actually play into and illuminate this area of distrust even more. But we did want to show some of these open-end responses to what consumers are actually saying about these topics, just so you can hear it in their own words. So when it comes to that rush to move faster, people are saying, I feel like they don't really take the time to understand everything going on in my life to determine the reason behind my medical conditions. People are saying, if the appointment feels rushed or I don't feel completely heard, then I may lose some trust. The healthcare providers are too big. You become just a number. I sometimes feel rushed or as if she doesn't believe my symptoms. They use the generic treatment instead of treating me as an individual. So you can kind of see all those things that, we do as healthcare, oftentimes because we are rushed or we are following protocol. Those moments are places where people feel like we might be moving too fast and they start to lose some of that trust. The misaligned priority side, this is where people almost get into, lens of conspiracy theory of thinking because they're somewhat beholden to big pharma or insurance companies, they can't or won't take time to customize healthcare treatments to me individually. I've heard things about doctors getting money for pushing certain prescriptions, so I can't be sure they're always acting in the best interest of just the patient. I think that it boils down to the fact it is a business and they need to make money or save money where they can. I trust my provider, but not necessarily the health system he works for. So a lot of those kind of subtle dynamics that are really hard to combat. And I can't say that we have identified a silver bullet to combat that, honestly, because it is such a deep challenge. In the book, in the full report that we published, we included a little sidebar example from Oatly, and I think it's interesting. Obviously, oat milk is not healthcare; it's not that complex. They're not the same high stakes, but I think they're a brand that just is interesting in terms of how they turn their idea of imperfection into a trust signal. So this is a company that will, admit where they're at, where they've done wrong, where they're still learning, where they've fallen short. And it's one of those ways that they've earned trust and more trust with the consumers that they engage with. So I think, some of these questions on the left are for us to reflect on and again understand that these are real challenges in healthcare. It's hard to own up to and be transparent about any, imperfections that might have happened, especially in the medical space. So we did want to take a poll here and just get a sense of how you think about this question. So how much do you agree or disagree? I feel that the risks of more transparency outweigh the positives. And we're being relatively vague about transparency here, but I would consider this to be more than just, price transparency, which I think is a place that we often go to in our heads, but just kind of transparency overall. Right. So clearly a lot of people here somewhat disagreeing, right? They feel that those risks don't actually outweigh the positives. So I think there's that push for transparency, but we also see people recognizing that there's that balance. So there's 12% of people that strongly agree with this, 16% of people somewhat agree, 9% of people there in the middle, but nearly 49, nearly the majority at 49% somewhat disagree, and only 14% strongly disagreeing with this statement. But I think it just starts to illustrate that challenge of finding the balance within how transparent can we be? What should we be transparent about? There's obviously regulations as well in place. So just starts to illustrate just the trickiness of the trust and transparency dynamic. So we wanted to go a little bit beyond sentiment, right? We've talked a lot about the data where we've asked people, why or what have they done. We wanted to dig a little bit deeper by actually looking at, what those underlying dynamics are in distrust. And we did this through some analytics, right? We started to look at what are the correlations between different factors of distrust and how much people actually trust their healthcare providers. So we wanted to ground this in something that we've been talking about, I believe, for the last two volumes in Humanizing Brand Experience, but we've called them the keys to the future. So these are the things that consumers are basically telling us are the things that are going to make healthcare better. These are the most important things for healthcare to be focusing on in terms of making their experiences more human and just better across the board. So those are listening, wellness, and personalization. And the thing that was really interesting in this data when we looked at that correlation analysis was that those very factors are the ones that actually are causing the most distrust. So when providers or systems don't listen to me, then my distrust goes up. When they don't understand my unique needs, my distrust goes up. When they don't empower me to improve my health on my own, distrust goes up. So it was fascinating to see this kind of one-to-one, almost direct interaction between when health systems don't deliver on those expectations that people have, those are the things that are actually, causing trust to fade. And like we showed earlier, will eventually cause people to look for alternatives. So really looking at this as that dynamic of, what we're out there promising and what consumers are expecting, and then what they're actually experiencing is one of those key parts of the trust equation that we need to be thinking about. We did want to look at this through the lens of our segments. I know I've mentioned them several times, but with that idea of personalization being so incredibly important and people wanting to feel like they're seen and recognized as an individual, segmentation is a tool that really helps us do that. And I think this is interesting because it can help us as marketers and how we communicate. But I think this is also a tool that, physicians should be trained on, people who are answering the phone, people working front desks, anyone who's engaging with consumers should have a sense for these different segments. And the nice thing is that they're relatively intuitive. And we've been using these segments for the past several years, and it's kind of fascinating every time that we look at the data around them. They just reinforce how true these attitudes are and how they play out across all the different types of topics that we research. So just a quick overview on the segments. The wellness influencers tend to be younger, but they're the ones who are out there at the forefront. They crave the most innovative approaches in healthcare and wellness. They're the first ones to try new things. They really care about their health more than these other segments. They're the ones with fancy gym memberships. They're the ones with connected technology. So they're really investing the most money and time in their healthcare. Habitual strugglers are almost kind of on the opposite side where they're really burdened by their health care. They're burdened with chronic conditions often. They are overwhelmed by navigating the types of care that they need. They often, have see multiple specialists and have multiple appointments and just see that their health doesn't tend to get better. It just is it's a struggle, like we say in their name. Positive preventatives, they generally have they have a positive outlook on life. They are doing the basics of care. They're generally blessed with just having relatively good health to begin with. They're not necessarily doing all the things that a wellness influencer would do. So again, just kind of the basics of maintaining their preventative care and luckily having good health to go along with it. The whole health managers we talked a little bit about, right? They're avoidant, they're distrusting, they're looking for alternatives. The trusting traditionalists, those tend to be the older generation of folks who are just going to kind of do what their doctor tells them, follow the basics, not overthink it. They don't tend to engage with healthcare in a super deep way. They're just kind of following the rules, so to say. Unapologetically unhealthy, those are the folks who they just don't care. They don't think about it. They don't really engage unless their limb has basically detached. Then they might consider going to a hospital. And then Dr. Dodgers, we talked about really younger, time pressed. Financials are an important thing about the way that they approach healthcare. I think it'd be fun. Many of you might have already done this before, but if you pull out your phone and scan the QR code here, you can actually go through the typing tool that we have, and it'll predict which segment you are. So scan it, come back to it after we're done here, but it'll just give you a sense of where you might fall into one of these different segments. But we did want to talk about some of those segment differences because I think this is where, it gets interesting and starts to illustrate how each segment has different reasons for why distrust grows and why it's important to recognize them as individuals. So these are essentially their top reasons for each group of why why the distrust grows with them. So with wellness influencers, the biggest thing for them, they're the ones that are actually investing the most time and money in their healthcare. They really don't appreciate it when there isn't that transparency around what it's going to cost and how expensive it may be. I think oftentimes this is when, all of a sudden they need an MRI and oh my God, that MRI costs, 500, 600, 700, whatever it is, dollars. That was unexpected and really catches them off guard. They also see that when those promises aren't kept or when they're not getting useful advice, they're the ones who want really tactical advice to make themselves healthier or meet their goals. So they don't listen to me. That's another one. You'll see that as a pretty consistent theme across all these different segments. The habitual strugglers, their conditions are complex, right? They have a lot of different things going on with their health needs. So when their providers and systems don't understand their needs, it feels like maybe that the system only cares about themselves and isn't giving them the right resources to meet their needs. And also, with so much complexity, they're not getting that level of clarity and explanation about what's happening. And ultimately, just feeling like they aren't listened to is what's going to drive that distrust. Positive preventatives, again, they're doing the basics. They're following, just what they need to do for preventative care. So, the basics of navigating their insurance is actually top of mind for them. And they want the right information at the right time, and they want people they engage with to be helpful. So, lots of different things that drive distrust with them. The whole health managers, it's when they don't feel like they're a priority, when, they're not actually being empowered to improve health on their own. And given the right information that they need is when the distrust rises with them. So again, going back to the level of distrust that those folks have, this is a pretty often experience for them where they don't feel like they're the priority and they're not being listened to. And then again, the trusting traditionalist, for them, it's about just getting that time. Feeling like when they're seeing the physician, they're getting to spend the right amount of time, they're getting the attention that they need. They want to feel like they're the priority, and they don't just want the medication pushed on them. They do want to understand the root cause. So I think that's an interesting call out for them that might be a little bit surprising. The unapologetically unhealthy finances, that sort of mistrust of, do they care about themselves and their finances? Those are typical things for them. And then finally, the Dr. Dodgers, again, that not listening to me is number one here. So that showed up in all the different segments, but was number one for them. And they want to be able to have that empowerment to manage things on their own, and have the right information that they need. But you also see some of those things about, being able to make appointment quickly. When they can't make an appointment, then they start to not trust you. So all these things start to play back into just their level of, the same attitudes that we've seen pretty intuitively present with them since we've been measuring them. We also wanted to just quickly cover off, almost to the end here, cover off on, just Gen Z, because we talked about them earlier and recognized that, they are the most distrusting generation of healthcare. So we wanted to isolate what those reasons were just with that generation. And, one of the things that we see is that it is that just that deep distrust of large institutions. I think they just feel like these big institutions have too much power. They only think about themselves, and they're not giving them, again, that empowerment to do things on their own. You also see, on the other hand, which is good in some ways, because there's really practical things and tactical things that we can do to, earn their trust back or keep them from distrusting us anymore, is just that speed, right? Making it easy for them to book an appointment. Don't waste their time, or, having them take too long to, just waiting in a waiting room even. So I think some of the speed related factors with this generation is one key to really bring them back. And then again, listening, which is really a constant theme. We really do believe is a strong key to the future that we need to be considering. So with that, we wanted to share just, kind of our takeaways, our recommendations on what to do. What's the action plan? I think one of the things that's just most important to think about is that trust is everyone's job. There is that dynamic between promise and delivery that's kind of at the cornerstone of this equation that we're building. So if we as marketers are out there, promising a certain experience, and then we're not actually delivering it when people are engaging us, that's going to be a fundamental driver of distrust. And so some of the tactical things that we think that, is good to do is getting really specific about trust, right? And focusing in on those areas that are really most impactful in that distrust equation. So simple checklist for the communications that we create, the services that we design, the cultures that we build, of are we listening and do we understand this person's unique needs? Um, Listening and personalizing is really key. We want to talk about it, but also it's most important to show it so that people actually feel it in those experiences that they have in the touch points that they engage with us at. Incredibly important. I think another thing is from a measurement standpoint. So just that idea of auditing for trust fractures. So measuring that experience versus expectation gap is going to be key to see, are there places where it's eroding? So thinking about doing pre-post surveys of, what's your expectation for this visit or for this procedure or for this engagement? And then measure it afterwards to see how it met expectations. I think as you do those things across different touch points and get specific about it, you can see those areas where you might need to intervene. There might need to be design solutions or service recovery or whatever it may be to make sure those trust areas of fracture don't continue to grow. And then finally, and probably no surprise, it's really knowing your audience, right? That idea of building on personalization, understanding where people are coming from. Talked about it with the segments, right? Having the ability for your people, not just marketers and communicators, but frontline staff, providers, clinicians, people on the at the call center, have them trained in who these segments are and recognize intuitively who they're talking to, so that they can really start to tailor the information they're providing, the way they talk, the interaction overall, just to deliver against what might be that person's mindset, and make them feel more listened to, more seen, and more heard. So that's the end of the content. I did want to just hit a couple of just quick plugs for things that are coming up. As I mentioned, the information, the next chapter, all about legislative changes when policy becomes personal. We'll be publishing that data on February 24th. And then May 19th, later in the spring, we'll be publishing the full Humanizing Brand Experience report. So that's where you'll have the most human brand rankings present. And then we also just wanted to mention that, we're going to be at HMPS in Salt Lake City. So that's May 3rd through 6th. And if you stop by and see us, we're going to have early access to what your brand's ranking is. So you'll get a little snapshot of where your ranking is, and just some of the data of where you compare to the other 200 health systems that are ranked in the study. So I'm guessing you got questions.
Yeah, thank you, Dave. We've already had several questions coming in. And as a reminder, if you have a question, simply enter it into the Q&A pane at the bottom of your screen, and we'll respond to as many as we can. Um, we'll start with this one that came in. It was in reference to the Dr. Dodgers and Whole Health Managers slide earlier in the presentation. What questions were used to identify people as Dr. Dodgers or Whole Health Managers?
Yeah, so if you scan that QR code, you'll see the exact questions that defines those in the study. And then the way that whole segmentation was built was through a clustering analysis. So there was a quantitative approach to understand the way those different dimensions, those kind of trade-offs of how people approach their healthcare and the mindset, actually factored out into those unique segments. So those are something that we've been measuring for several years. And again, like I said, it's really fascinating, all the data that we see. People really, those segments respond almost as you would expect them to respond. Very few surprises. I will say, as individuals who have scanned it and maybe taken the questionnaire, you might have come up with a surprising response, but generally, most people we encounter say, "Oh yeah, that does sound like me."
All right, great. Sort of building off of those two particular segments, how much does lack of access factor into sort of those characterizations?
It's hard to say. So we saw lack of access as a major issue coming out of COVID. It started to rebound it started to rebound last year. I don't think I've seen it completely present in those segments. I will say, especially not for the whole health manager, for the Doctor Dodger, the access could be somewhat driven by just the financial pressures, and the time. So if appointments aren't readily available, then that's something that discourages them. So I'd say access would impact the Doctor Dodgers more than anybody.
Terrific. And Dave, if you wouldn't mind, could you bring back that slide up with the QR code in case folks wanted to scan it again? Thank you. Um, Another question here is, as a marketer, it can be challenging to impact operational changes. What can marketing specifically do to help build trust?
Yeah, I think that one's interesting. I think there's that basics of knowing what you're capable of delivering and having those reasons to believe, right? And making sure your communications are backed up by where the organization is and what they can do. The other interesting thing, and this is something one of our clients did recently, and we helped them essentially build a custom model. And the model was designed, and it was based off our humanizing brand experience model, but got a little bit more specific. But it was designed to kind of carve out and parse out how much marketing versus digital experience versus human experience versus environmental, physical experience. Each of those things, how much did they contribute to choice? And it was interesting because what we found out was that the marketing piece of that model was actually only one small piece, right? And it's not surprised that the other pieces had a huge responsibility in driving choice and loyalty. But it allowed the marketing team to start having this conversation of, hey, we're actually only one part of this equation. Our data is actually showing that we're kind of holding up our end of the bargain, right? We're out there creating this promise, but we're worried about getting too far ahead of what the rest of the organization is delivering. So it's a bit of a wake-up call to leadership, and this went all the way up to the CEO to say, "Hey, we have issues in our product, in our facilities, in our experience that need to be fixed, so our brand can continue to progress."
Okay, great. We have another question here. When it comes to distrust about decision making, is this because the patient experienced a wrong decision by the healthcare provider, or because the provider isn't listening and communicating the plan, treatment in a way that the patient can understand, or is it just something else?
Sorry, can you repeat the beginning part?
Sure. When it comes to distrust about the decision making, is it because the patient experienced a wrong decision by the healthcare provider, or because the provider isn't listening and communicating the plan or treatment in a way that the patient can understand?
Yeah, that's a good question. And I think a lot of those things overlap and right, a lot of these things can be true at the same time. I feel like again, going back to listening being so important, if it feels like you haven't been listened to, if it feels like the interaction has gone too fast, then it's likely to be, distrust in the engagement, distrust in the recommendation. They don't really understand my unique needs. So I think again, it's a big combination of those different factors at play.
Great. Um, so yeah, building off, I guess, this listening, we have a statement question here. It's amazing how the need for listening to patients is universal across all the segments. Uh, this has been persistent for how long, and have there been any like major improvements that you've seen?
Oof. Improvements is challenging. I don't have a lot of great examples at the tip of my fingers, but I think it's been growing for some time. Because I think we used to talk about this in phrases like control, and we talked about it in growing consumerism. And I think what's happened now is that you just have people with access, you have patients with access to just so much information. And then the people who they really saw as experts almost feel like they're not giving that same level of attention. They're not getting that listening and that dialogue. We will talk more about in the upcoming book release about AI and some of the things that AI is doing because um, not that AI is a great listener per se, but AI becomes a source for dialogue and it provides answers in ways that are more understandable than sometimes classically trained clinicians respond to things. So there's an interesting dynamic evolving with the presence of AI here.
Okay, that's great. Is there any clarifications on the results for those with chronic health conditions managed by specialists versus people who generally only need primary care?
I think that's where the difference is between the whole health manager, or sorry, the habitual strugglers and folks like the positive preventatives really come to life. I'd see the habitual strugglers, those are the ones who are really engaging with specialists and all the challenges that they have with scheduling, having their specialists talk to one another, and those types of things really kind of drive up the stakes for them. where the positive preventatives are more of your, kind of basic primary care consumer. They're doing the basics. They're engaged, and again, they tend to have good health, so not as high stakes with them.
Thank you. In your research, what comes first in a decision-making chain for a segment of prospective patients who are on Medicare or ACA? Is it cost insurance, then they look for trust, or does trust trump all?
Yeah, I mean that's a challenging one. I think trust is like a door opener in many cases when we're thinking about just levels of trust entering into a decision-making moment. I think you'll see trust as sort of top of the funnel, right? And driving consideration. If I don't trust you, then I'm probably not even going to consider you. But as you move down that funnel into actual choice, that's where I think insurance really does play that role where if you're not going to take my insurance, but I trust you, gonna just look for somebody else that hopefully I can trust just as much. So insurance does play a big role. I'll flip back to this slide. It doesn't really completely address the question, but just wanted to call out that there were similarities between just levels of switching related to trust. Those were the same basically between those who were on government insurance versus private insurance.
Thank you. I think we've got time here for one last question. I've had the experience where the provider was too busy to see me, sending me to urgent care twice and then emergency all in the same week. Has the experience of the provider not being present or available ever come up in your surveys?
Um, yes, I think the inability to get an appointment is a huge driver of. I mean, it's a driver of delayed care. It's a driver of switching. It's a driver of losing trust, as we've seen here. So, yes, it definitely comes up, and definitely comes up in the open-end responses we see.
Um, all right, I guess we can do one more here. Were there any considerations on how people's minority identities may influence trust, LGBTQ plus, racial minorities, immigrants, etc.?
Yeah, so the only data point that we had, and that I can recall from the top of my head, it was just this one around demographics between white and non-white. So I mean, you do see somewhat of a difference there, just measuring those two groups, with a bit more switching based to trust happening for white folks, but we haven't dug into those dynamics deeply here.
All right. Well, thank you, Dave. I'm sure the audience joins me in thanking you for that terrific discussion. And thanks also to all of you in our audience for carving out time to join us for such an important conversation. Please note that if you asked a question that we weren't able to get to, we will do our best to get a response to you. The forum will also be sending out a link to the webinar recording in the next few days, so be on the lookout for that. That concludes today's program. We hope to see you at future forum webinars, as well as the 31st Healthcare Marketing and Physician Strategy Summit, May 3rd to 6th, 2026 in Salt Lake City. Please visit the forum website at healthcarestrategy.com to learn more. Finally, be sure to give us your feedback by completing the evaluation survey as you exit the webinar. Thank you and have a great day.